Go ahead.
Good evening, all. This is Dietitian Flora here. I'm back with another topic. Can body impact on the fertility health? Yes, today I'm going to talk about what are the weight changes has to be made to make it successful, the treatment basis, like fertility basis. So, especially, let me tell you what it is being like underweight or overweight can really affect on your ovulation. It's like being underweight or overweight, it has to know that what where you are into. It might be the BMIs. If your BMI is below 18, then always the experts tells that to maintain a healthy weight if you are underweight. So yes, it's like it may affect on the ovulation because you might sometimes see the changes in your cycle and it would not be in a regular basis. Then the ovulation, the hormonal imbalances would be seen in the changes of your weight. If you need to always know like what weight you have to be and what kind of a body fat you are into, and especially into the treatment, it really affects like being underweight or overweight. Both can affect in the ovulation, right? So next is like not only for being for women and the women, but also we has to know about the men also. Even both men and women both has to check their BMIs. Like if you are underweight, it might affect like if you are like hormonal imbalances would be the PCOD. Yes, again, and for the men, again, your testosterone hormones would be to the lower side, and excess body weight can increase the estrogen levels, right? So here, if we are looking into the PCOS and the hormonal imbalances for the men, you have to know like what kind and how to maintain. So here is the main way to exercise and to maintain it, like not only the weight through the diet where you has to maintain it, but you need to check like what kind of stressed you are mentally and physically, how anxiety you are in, how it is maintained through the like daily of your schedules. So it has to know that are you are stressed with some other works would be like hormonal imbalances can happen, then overall the body changes, right? So it has to know like what are your internal stuff then. So if you are having like imbalances, like not following a proper diet with a timely and a balanced diet can affect you on this. And other thing is like how moving around you are, how much time physically active you are, you need to know about it. If you are not being into that, you have to start to move around to maintain your healthy BMI. It is like 22 to 24. Like we always experts and the doctors like always check the BMIs to get a good response by ovulating on a time, having a good quality of your egg and a good quality of the sperms, right? It there are many of the follicles, but you have to know like what it is in the right way and how the quality and the quantity should be know like how it is. So you should always maintain with the lifestyle modification is always a first priority where you have to know, and the changes of the lifestyle will always make you in a proper working of your hormones. Like moving around can activate your hormones, and burning the calories, like how many calories are you eating and how many calories are you burning, you need to know about it. And you need to exactly plan it and schedule it so that you have to maintain accordingly. So if I come with the next line, I mean the next point, if I see weight changes decreases the male fertility as well. So you have to know like where as the what kind of a woman and the man both should has to be together, how the couple works together. Like if you both uh, uh, unitily you have to make it, and you have to plan it accordingly, and both of you has to maintain the weight as well. So apart from this, weight challenges can impact the success of the IVF treatment. If we see in the treatment how much the weight can affect in the treatment basis. Yes, if you do not follow the proper diet and the physical activity when you are into the treatment of the IVF, your if you do not maintain your androgen levels, the main hormones would increase up high, and it can affect on the proper ovulation, and it might trigger a lot in the implantation as well. So you always we doctors suggest, and they do check the weight, and they do suggest for the weight loss. If I tell you the patient is around BMI is around 30 plus and 35, and always the doctors would suggest first priority is like weight loss. Weight loss, we do have weight loss in the weight loss packages in the Oasis Fertilities. For you have to maintain it by not 1 month or a 1 week, or not putting it on a crash diet. We do advise is a good, a balanced, healthy diet with a lifestyle modification, and which can make you sustain for the longer time. We do not give you any temporary weight loss. We do have prime packages, pro packages, like a 2 months package or 3 months package is like something has to sustain for the longer time, where it can maintain a good healthy weight by maintaining like not only for the 1 day 2 day, it has to maintain by 1 month 2 month 3 months according to your BMI. If for example, do not expect one fruit if you have in a day to get positive in an evening. So it is not like that. So it is like something you have to do it like every day, like eating a good diet, maintaining on a healthy lifestyle, and maintaining your good in having a timely meals by moving around, and how much quality of your sleep into, and how much stress you need to are. So you need to change your lifestyle. You not for 1 day or 2 day or a week. You have to maintain for a month or a 2 months or 3 months till you get a target weight. So usually what happens is like in a 1 month one we do give for the weight loss. If the BMI is around 32, so we if the patient is around 32 and her ideal body weight is around 53, so she has to reduce almost 15 to 20 kilos, right? So it takes time. By 3 months we do give time for losing weight for 3 months. So we do tell that to reduce the weight in a month like 4 to 5 kgs by maintaining a good diet. So here how I do counsel my patients like putting a 80% on the diet, because diet is number one, where I has to put you like adding up a good folate rich foods, I mean omega 3 fatty acids, like vitamin D rich foods, I mean vitamin E, which can help and strengthen the reproductive system, and which strengthens the reproductive system, which implants well. These are the nutrients where we need to add by giving a low calorie diet, low carb diet, and low fat diet, by adding, by strengthening up the muscle, by putting up more of fibers, more of protein, like high protein and high fiber, depending on the what kind of a diet you prefer. I mean, if you are vegetarians, we need to look into. If you're non-vegetarians, we need to look into. So always we need to plan a diet by maintaining a good healthy lifestyle, which can affect on the fertility when you are into the treatment. So always plan accordingly by take time for yourself. It is not like giving up after a week, feeling weak after a week. It is not like that. So you need to maintain, and it has to not to be unsustainable. It has to always be sustainable to maintain a healthy, good lifestyle. That is how. And apart from the treatment, if we look into the weight changes and the challenges can also lead in the pregnancy complications. Yes, if you are overweight, you might you might be I mean, the complication might raise up to the preeclampsia. I mean, the gestational diabetes. You might put on the excess weight, not the target weight, where we give almost a cutoff weight loss, weight gain up to 10 to 12 kgs. You might put on more weight by uh, gaining weight almost like 3 kilos in a month or 2.5 kilos in a 1 month. If you are in the pregnancy, you might see some different complications in the pregnancy as well. If you are underweight, you might see like preterm deliveries, and also by lower birth weight we do seeing all these complications in nowadays. So you need to maintain the good ideal body weight according to height as the weight. You need to always know to check your BMI by maintaining a good healthy weight in the treatment, not before the treatment gets started, and after the treatment get positive. You need to maintain your weight even if you are a pregnant also. And if you are sure, if you are having a healthy weight, are you sure that are you following a good diet by giving into a crash diets? It would be the any other diets like keto can be sustainable. Are you into that? So keto or any intermittent fasting would be, it can be maintained, but not every month we has to look into that. So if you want to occasionally, if you want to lose weight around meeting up to 4 to 5 kilos, if you want to lose weight by maintaining a healthy intermittent fasting, yes you can, but it is not sustainable for the longer time. We have to always choose a Mediterranean diet in the treatment, choosing a good healthy balanced diet with the timely meals, which will always be helpful in the treatment. So you need to know like what are the foods to be added, what are the foods to be avoid as well. Usually we do avoid in the treatment basis like all the preservatives, the junk foods, in the low calorie diet, as I was talking about, too much of burnt foods like all the I mean, the non-veg would be, you need to have a good amount of protein as fats, would always be helpful in the treatment, and it always makes you successful for the implantation. So healthy weight solutions. So what are the to maintain, like how to maintain a healthy weight solutions? So solution for the healthy weight. Yes, uh, where are you starting your day with, and how is your planning, how is your diet plan is starting with? So you need to know like how many kilocalories you need to burn in a day, and how much target weight loss you have to reach around, and how much obese you are into, you know about. First thing is always know your BMI, and how much target weight loss you need to reach around, and how many kilocalories you need to eat, and how many kilocalories you have to burn to reach your, I mean, the weight loss, right? So always these are the 3 points to keep in your mind, where accordingly a dietitian here or I myself has to plan according to your height, weight, according to your BMI. We do calculate and we do put around into the packages. Like I was talking about the packages like Prime and Pro, like 2 months and 3 months, we has to guide you like continuous follow-ups we do give, and in a in a 2 months we has to change the diet plans. Almost 3 to 4 diet plans will be supporting you, like making a changes in different diet patterns. Like if I give you in a first diet sheet, if I give only in a low complex carbs with high protein and high fiber, then wholesome foods, always we do choose a wholesome foods which makes you full easier, and which are rich in vitamins and minerals, and antioxidant diet which always helps you to fight from the, I mean, the infections and all. So always make sure you feel full and have always add a wholesome foods. And next level of diet which comes, and we reduce the calories to see that, because in a one diet chart you always lose like at least for 4 kilos or 5 kilos in a month. In a month, I'm talking about in a month. Now, so if you are working like physical activity, like almost like spending yourself, like doing a brisk walk, yoga, and swimming, jogging, aerobics, any kind of physical activity, moving around, burning more of calories, like almost 8,000 to 10,000 steps we do give for the weight loss. So depending on the treatment, we do advices. Usually we advise walking and yoga safer to have not any kind of rigorous exercises. So maintaining a good diet with a good physical activity, you might reach a target in a month, because we are not avoiding the food completely. So putting on a 80% on a diet, you can see the changes like almost 4 to 5 kilos in a month. So we do make changes in the diet chart as well by making it to a different diet plans. It would be the detox diet, it will be the cleansing diet. All these depends on your conditions and your complications we need to plan about. So if you are underweight, you has to put you on the more of complex carbs, and also by adding a good fats which have where you can weight gain by maintaining a healthy weight gain. So always we do in a balanced form, which always make you full and keeping around, moving around. So adding up a good fats to you, so which has helpful in the treatment as well. So this is how. So solution comes in a healthy way always. If you're not, if one diet sheet is not being sustainable for the longer time, you need to change the plan, you need to change the method of the doing the diets. You need to at least increase the physical activity with yoga and the walking. Both can be impact on the weight loss sooner. So you have to know, and you have to make it always in a good way where it can impact on the weight loss and as well as the weight gain according to the complications. So healthy weight rounding up, if I talk about, so healthy weight is something maintaining it, and not if you're doing diet, if you do not maintain it in a month, then again you'll rebound back to your weight, right? So always all my clients come, all my patients come back and tell me that, ma'am, I have lose some weight, but I have rebounding back. I've gained almost like 12 kgs like after when I stopped my diet. So it is not like, see, if you are avoiding some foods, then you need to know adding up. That is why we always tell in the treatment, choose a healthy balanced diet, like where it is called a Mediterranean diet, which we give from the all the food groups where can be sustainable, and every day you has to get used to it every day, not 1 day, 2 day, or 3 day, or a week, or a month, but always it has to sustain for the longer time, and it has to maintain for the longer time. Always it has to, not by maintaining, it has to get used to like eating a good food, like maintaining a good food, like all adding up a diet by different food groups, like for example adding the 2 fruits in a day, 3 vegetables in a day, one leafy vegetable in that, and milk, eggs, and protein, good amount of protein, complex carbs, avoiding a simple carbs, not choosing a processed refined product. So these can be always a good solution by adding a good diet, by maintaining a good healthy lifestyle, which will always make you fit and healthy and expand your lifespan up to 10 more days. So always to know about where underweight and the obesity can impact on your weight, on the treatment. Yes, it does happens, because underweight or overweight can impact on the treatment, where you has to know doing in the right way by both for the man and the woman has to plan it accordingly and do visit to us to the center. We do have the weight loss packages, and we do have a good treatment according to your complications. We do have the treatment accordingly if you are planning for the IUI, if you are obesity, if you're planning for the IVF, we do reduce your weight and we do treat you as well accordingly. And everybody, all the patients who are obese, they do have a query like, we are undergoing the treatment, can we follow the diet, can we reduce the weight? They do ask me like this. So yes, you can do the diet, because here I'm not avoiding the food. Here I'm just putting you on a good diet, where the treatment and the diet and the weight loss can happen when you are into the treatment. So the treatment continues, your diet should continue, and the weight loss journey has to continue when you are in the treatment of the IVF. In any other treatment would be, whether it be the IUI, because putting you on a healthy diet can store a good nutrients in the body and then flourish for the next day, right? So always maintain it for 2 months, then you can expect a result in the third month. Immediately, nothing happens. So this is how you have to maintain. By can sustain for the longer time, but not by avoiding, not for 1 day or 2 day or 3 day. Can doesn't expect or doesn't do it like I'm telling it, like do not do for 1 day or 3 day or a week or week 1 month. No. Again, if you gonna do for 1 month or 2 months, again it gonna rebounds you back what have been you lose. So you have to maintain it by a good healthy lifestyle, but changes in your lifestyle as well as your diet, which can sustain for the longer time. Please do follow all the instructions which has been given. So if you have any queries, let me know. I'll be answering your queries. Do I have any query over there? Does obesity affect the egg quality? Yes, egg quality is something which is affecting on the ovulation and the where I was talking about the PCOD, where the PCOD, as we know that all the bubbles which has been surrounded around the egg can reduce the quality of the. It would be the many eggs, the quality as yes it reduces. So maintaining a healthy diet and reducing the weight is always helpful, and to maintain the good healthy weight will always increase a lifestyle, especially the lifestyle, and what are the habits, for the food habits you are into. Are you taking a good healthy food, or also are you choosing a junk food? You need to know, and it will affect on the egg quality. Yes, it does. So to improve the egg quality, you need to maintain a good diet with a lifestyle modification, then it can improve the egg quality. Next question, please. Can I get IVF if I'm overweight? Uh, yes, you can go for a IVF if you are overweight, but you need to maintain your weight. As I was talking about, as the treatment goes on, you need to maintain your weight loss as well. You need to plan for the weight loss, and you can continue for the treatment. If you are obese, like almost like a morbid obesity, like BMI around 40 plus, then you need to go for some weight loss, then you can plan, but according to the condition and according to your body, doctors would suggest for the weight loss, then you can go for the treatment. But according, if your BMI is around 30s, you can go for a IVF as well as the weight loss as well. Both can go together as well. Next query, please. Can losing weight help fertility? Yes, losing effective on the weight loss will really help in the fertility, because it improves your egg quality, it will store all the good nutrients in the body, where the it start generating it, the hormones start working on it. So all the which I mean what weight loss you are into, so always make sure to have it. That is what I was talking about. Like you need to maintain it like almost 2 months or 3 months, so that it can be very helpful in the fertility, I mean the treatment. So always fertility weight loss is something where it improves in your hormones, and which plays a very important role in the treatment as well. Does obesity stop ovulation? Yes, it does stop the ovulation, because of the obesity, we have been seeing all the other hormonal imbalances would be like thyroid, PCOD, all these, where the sudden changes in the weight loss. So it stops the ovulation. That is why we do, I mean, we have been facing many cases of not being pregnant because of the, I mean, unovulated. So you need to maintain a good healthy weight where it has to get ovulated. You need, especially the diet and the lifestyle modification will help you in the ovulation. I think I'm done with the queries, and thank you a lot for joining us in the live session. Uh, we'll get back to you soon with another nutrition topic. Thank you. Take care.